So, good morning everyone. Good morning to my fellow doctors and also to our friends from the media. A pleasant morning to everyone. So, welcome to our activity today. This is the Dengue Media Roundtable discussion, and this is organized by the Philippine Pediatric Society, Davao Southern Mindanao chapter. So, I am actually Dr. Jocelyn Mantilla. I am the current secretary of the chapter. I am a practicing pediatric cardiologist. I'm affiliated with the Southern Philippines Medical Center, especially the Heart Institute. We are delighted to have you here all today to discuss some critical issues of dengue in our community. And I am joined today by our media practitioner and the health advocate, Mr. Cito Beltran. Morning, sir.
Good morning. Thank you, everyone. Thank you. And I have to read this. Baka alam nyo, medyo seniorly na ang Kuya Cito. Good morning, Dr. Mantilla. Good morning to my colleagues in the media and to my fellow health advocates from the Philippine Pediatric Society, Davao Southern Mindanao chapter. Thank you for joining us this morning. This is actually part of a series or several road trips that we have been doing. And the idea is for physicians, health experts to connect with members of media. You are the guests here, mga kasama ko sa media, you are the guests, okay? Hindi po kayo mga reporters, hindi kayo mga journalists, kayo yung mga guests today because as I do the rounds, there is a disconnect between media and the health practitioners. Parang the media don't really know who to go to, who to approach, and the doctors naman are kind of hesitant in approaching the members of the media. So recently I gave a talk sa PMA and I said to the members of the Philippine Medical Association that you need to be more engaged with media. So this is part of this. The PPS has actively supported the dengue awareness campaign. Why? Because there are many places where dengue is a serious threat, but the locals are not aware. In several provinces we went to, they were shocked to find out they were number 3, they were number 2, and I'm happy to know, not in a great way, but I'm happy to know that at least here in Davao, the members of media are very aware that we have a problem with dengue. Also last week, or actually this week, dengue became the center of discussion in national media because the cases have been rising. Quezon City declared on their own a dengue outbreak. And because of that, it forced the discussion to be put under the microscope, under the camera, under the microphone. So what we're going to do today is Doc Joe will introduce to you 3 experts and they will make presentations, national situation, the dengue in Davao, and particulars that our friends in media could use in writing a story. While we gave you a handout, okay, to our friends in media, we have not given you any press release because this is not a press conference. This is our engagement with you to better inform you so you can write your version of the story. May I just ask, sana wala, pero kung meron, may I find out, among the members of media present, have any of you had dengue or a relative who's had dengue? Can you raise your hand? 1, 2, 3, 4, 5. Tapos, I didn't get the name of the group.
Pasyente Project.
Pasyente Project. Maraming salamat po for joining us. So sabi sa inyo, medyo short memory na ako. Okay, anyway, so that's a lot of people. In Baguio, a member of media died because of dengue. In Manila, the well-known journalist broadcaster Conrad Banal had dengue and almost died. They had to transfuse him with 5 bags of blood. So even for media, it's a serious threat. So, Doc Jo, I won't prolong your agony. I will leave the work to you now. Thank you.
Thank you, Sir Cito, for that emphasis no, on the awareness for dengue. For us, actually, medical practitioners, we used to have this trend kasi. Dengue used to be seasonal before. But now kasi all year round na siya. Kaya it's been a very perennial problem. That's why this drive, against for this dengue campaign. So we have, as mentioned by Sir Cito, we have an exciting lineup of speakers today, and I won't prolong the agony of. I'd like to recognize the board of our PPSDS-MC chapter. They are seated here in our table. So our President, Dr. Jonas Suzette Heralde, our Vice President, Dr. Sally Figueroa, the rest of our committees, Dr. Trina Go is in charge of our CME, Dr. Mai Yang Son for our research, Dr. Vanch Bolapaulo for our community, and Dr. Claire Kanya for our child advocacy. So to welcome us for our activity this morning, I'd like to call on Dr. Jonna Suzette Heralde for her opening remarks. Dr. Jonna.
Okay. So to the esteemed members of the media, distinguished guests and colleagues, good morning and welcome to our activity. So it is my honor and privilege to address you as the President of the Philippine Pediatric Society, Davao Southern Mindanao Chapter. So thank you very much for taking time out of your busy schedules to be with us to discuss an urgent and timely issue that has been affecting us, affecting the whole region and the nation as well, so that of dengue situation. So dengue fever, as we all know, continues to pose a significant threat to our health and well-being, particularly to the most vulnerable sector of our society, the children. Okay? So as pediatricians and healthcare professionals, we hold a critical role in the fight against dengue. So today, we share with you the initiatives of the PPSDS-MC, the initiatives that PPSDS-MC has undertaken in this advocacy. So actually, we have participated and in several advocacies about dengue. No, so we call ourselves as dengue warriors. So I also would like to emphasize the role of the media in this particular concern. So the media plays a great responsibility in spreading accurate information and awareness. So through your platforms, you can reach wide audience. You help the public make informed choices to safeguard themselves. So in this era of digital information, media plays a great role in fact-checking and correcting misinformations. So your commitment to delivering accurate, evidence-based information help build public trust. So today's event is an opportunity for us to foster collaboration amongst all stakeholders and reinforce our unwavering commitment to protecting the health of all, especially our children. So as we move forward, let us remember that the fight against dengue cannot be won by a single group or entity. It requires the collective effort of the entire community. So together, we can make meaningful strides in this advocacy against dengue and create a healthier and safer future for all. So again, welcome and thank you.
Thank you, Dr. Suzette, Dr. Jonas Suzette Heralde for the opening remarks. And like I said earlier, the involvement and support of the Philippine Pediatric Society, particularly your chapter, is important. And Doc Jo, I'll turn over the formal program dahil usapang doktor na yan.
Thank you, sir. So actually, as mentioned, we have 3 speakers this morning. So for our first speaker, it's my privilege and my honor to introduce her to you today. She earned her medical degree at the University of the East Ramon Magsaysay Memorial Medical Center, had her fellowship training in pediatric infectious disease and tropical medicine at the UPPGH, and currently she holds the position as in pediatric infectious disease specialist both in SPMC and Davao Regional Medical Center. Lagi po namin siyang kinukulit, siguro araw-araw hanggang linggo. Masipag po itong mag-rounds hanggang doon sa Tagum, no? And also, she's a member of the Children's Cancer and Blood Disease Unit of the SPMC. So, she is also the recipient of the St. Jude Children's Research Hospital, Department of Pediatric Medicine, Global Academy of Infectious Disease Training in Tennessee, USA. So, to discuss to us the national dengue situation, please help me welcome Dr. Maria Delta San Antonio Aguilar. Doc Delta!
Okay, so good morning everyone. Of course, I'd like to commend our Philippine Pediatric Society Davao Southern Mindanao chapter for being here. It's a Sunday. I know that you know that doctors spend time with the family on Sundays, but this group of officers and board members are very much dedicated. We just had our convention yesterday, so they were also busy. Now they're still here for all of us. So thank you very much, Dr. Geraldo and the whole team. And I'd like to thank also the media who are here. So today I'll be talking about the Philippine national dengue situation. So we all know that there are 3.9 billion people who are at risk of dengue. And back in the year 2000, we were only counting about 500,000 cases. It increased 8-folds. In 2010, it became 2.4 million, and in 2020, it was up until already 6 to 8 million cases. Now, WHO reported 5 million cases worldwide, and there are more than 5,000 dengue-related deaths reported in countries. So these increased cases are consequences of El Nido phenomena and climate change, which leads to increasing temperature, high rainfall, and of course, humidity. Next slide. So the Philippines is the highest number of dengue cases reported in the ASEAN region as of November 2024. So you could just imagine that this is 1 month before the end of 2024, and we were already top. So we were reporting 1,000 cases in the Philippines. Our neighboring countries have reported 100,000 less, with 202,000 in Indonesia and 106,000 in Malaysia. Next slide. So dengue is a public health concern in the Philippines. In fact, we would want to say that it is a societal challenge rather, because this is not only a public health issue, the society, the community needs to be involved as well. So looking at the statistics, we see that again in the 2024 November, you already have an 881 deaths, and there has been decreasing deaths reported in 2020 to 2021, of course, because of the pandemic. We all know that at that point in time, everyone just stayed home, so more or less, diseases were put down at the lowest level. Next slide. So, highest case fatality rates of dengue in the Philippines were observed in the very young and below 9 years of age, and also among the elderly. This population, extremes of the population, rather, I would say, are very susceptible to dengue. So these are 9-year-old and below. Particularly, we get even cases of dengue as young as 6 months of age. So there's such a thing as congenital dengue nowadays. If you haven't heard of it, we do handle those cases as well. And of course, aside from the infants, the children, and the teens, which are very challenging cases of dengue because of a lot of factors. Some of them are obese, some of them already are not telling us that the case is severe, or the symptoms are not full-blown until they are really bleeders. So they come in because, again, teens are very hard to talk to, you know that. And of course, the elderly. For the elderly, as of last year and first quarter of this year, we've been getting reports from our counterpart internal medicine doctors that they have been getting a lot of dengue among the adults. So this is not just an issue of children, the adults also are involved. Next slide. So dengue case statistics as of November 16, 2024 have skyrocketed to about 340,000 cases, and this is an 81% increase compared to that of 2023. And we have reported 881 deaths. So this is actually an underreported number because, as you all know, this is only for those who are complying with the OH statistics, but we still do get deaths from other neighboring areas, particularly in Davao. So small hospitals, they do have deaths also that are caused by dengue. Several provinces have declared state of calamity this year because of high number of dengue cases in their locality. So to mention, there's Iloilo province, there's Samar, there's Capiz, and there's Eastern Visayas. And just last week, we got news even from the Philippine Pediatric Society that Quezon City, as what Sir Chito said, already declared their outbreak as well. Next slide. So cities and municipalities with high dengue cases, of course, there's Baguio. Although they really have a very good leader and also a very good setup in terms of dengue management, as I have been told by my colleagues in Baguio, but yet there are still a lot of cases that have been reported. Davao, on the other hand, we say that it was before the cases rise because of seasonality, but remember, because of our weather condition here in Davao, wherein we get rains every night, almost every day, we don't really look into seasonality already. We get cases every day, so this is not something we say that, oh, it's worse when there's too much rain, because rain is still every day in Davao. So this is something very perennial. This is something we see on our daily clinics already. But I think one thing we're proud of is that because of our knowledge and our early timing and also detection, we have put down the death very minimum. So we get cases that are really severe and warrants hospitalization and have led to death, but we do have a lot of successful cases that we were able to send home all our patients with dengue that are now back to their regular lifestyle, and also they're now going back to school. So we have good and bad stories, but as it is now, I would say we have a lot of good stories because death is really on the minimum. So here we also have other provinces and cities that issued local ordinances in terms of dengue control. And there's the state of Catbalogan and Iloilo, Rojas City, Quezon City issued also statements, including Pasig, Baguio, and even in Manila and also in Davao. So in Davao, let me just highlight, next slide please, that there has been an ordinance on the Davao City Mosquito-Borne Disease Protection and Control Program. So this ordinance mandates the creation of the dengue task force in each barangay and penalizes individuals found to have mosquito breeding sites. So I'm not sure how strict they are, but in our, as doctors, we always reiterate and we always advise our parents that they really have to clean up areas that might be suspected mosquito breeding areas. So in our consults with our parents and our patients, we always do education. It's not enough that we tell them that, you know, you have to go and seek for early consult, but it's always good to advise them on the environmental issues that they need to do in order to prevent mosquito breeding sites that might possibly cause dengue. Next slide. So efforts of the local government on dengue control have also been reported. So there are misting operations, although we say that there is, it's no to indiscriminate fumigation or misting, okay? When we say indiscriminate, it has to be a coordinated misting process because, as you all know, it will just divert the area of the breeding to another area. So it has to be a coordinated fumigation process. And then there's also the community cleanup drive, of which we always emphasize, particularly from the barangay level, that they really have to clean up. They have to be able to encourage their to do personal cleanup in their areas. And the public awareness of the campaign, I guess this is a year-long event as a pediatrician, and so with my colleagues, we always make sure that we advise and educate our parents and our patients. Barangay dengue brigades, of course, there are issues on this, but sometimes this is outbreak driven. So most of the time, I'm sure you also agree with me that we get to feel their presence only if there has been an outbreak. And of course, reactivation of the hydration units. So SPMC has created special for this. We always make sure that we attend to patients who come in suspected of dengue, and monitoring and reporting. So even in the household, in the school, or even in our private practice, when we get patients who are admitted for dengue, we always make sure and advise the parents that they have to report that case to the school and to the barangay. Next slide. So the WHO calls the integrated multi to dengue, which includes vaccination. So that's vaccination with dengue vaccines. That's a well-executed and sustained vector control. Of course, communication strategies, which this activity is part of, and an evidence-based clinical care, and of course, the robust dengue surveillance. So all these are just intervention to respond to dengue prevention. But apparently, there is no proven effective treatment for dengue. Dengue prevention is considered a key approach when it will involve immunization. That's why, as pediatricians and as healthcare practitioners, we would want to push the inclusion of a vaccination program against dengue. Now, in the market today, there are already two existing dengue vaccines. There's the first generation and the second generation. Apparently, the first generation is no longer available in our country. This is a live attenuated tetravalent vaccine with yellow fever virus as the backbone. So it was previously licensed in the Philippines, but is no longer licensed here. And this has been used in 20 countries, including that of the US and Singapore. And to give you a personal account on this, me, my family, and the whole of my clan at that time who qualified for the 9-year-old start of the vaccine availed of this. And we're all alive, and we haven't had dengue ever since. So I'm a living testament that my whole family is dengue vaccinated, and we're all well, despite the other conditions that my other relatives are having now. So what I'm saying is comorbidities are coming out, but all is well. And of course, the second generation dengue vaccine, this is what we are trying to promote right now. So it's the live attenuated tetravalent vaccine with dengue virus as the backbone. It has been licensed in more than 20 countries in Europe, in Latin America, in Asia, particularly in Malaysia, Indonesia, Thailand, and Vietnam. So hopefully we would want this to be licensed in the Philippines as well. So this is to say that right now there are already new vaccines that have been coming out. These new vaccines also had new vaccine technology. So it is far different from the ones that have created the fiasco. So there are these countries who are implementing dengue vaccination as part of the national immunization program. And to mention, there's Brazil, Indonesia, and Argentina. So these pioneering countries have demonstrated that dengue vaccination in their national program really helped reduce their dengue issues in the country. So for example, in Brazil, it has become a national. So they were able to vaccinate 5.2 doses that covers 3.3 million population. And in Indonesia, it was started in a school-based basis, so it was provincial, being able to vaccinate 13,000 students, and they were able to give out more than 27,000 doses. And of course, in Argentina, it was carried out through a provincial dengue program, and it vaccinated about they gave out about 1.3 million doses. So again, this is not something that we will be starting. It has been started in other countries. And if you look at them, these countries are also tropical countries just like ours. That's why we wanted to push it, because we have the same, somehow, we have the same kind of temporality that they have. So we also experience hot and cold. We have lots of rain, just like in Brazil, and of course our neighboring Indonesia, and also in Argentina. So Brazil was the first country to implement dengue vaccination as part of the national immunization program. So they have the national strategy for dengue vaccination, of which they were able to use the TAC 003 or the second generation dengue vaccine. It was targeted to a population of 10 to 14 years of age initially, and their target is 90% coverage. So their strategy was to give it out for high transmission municipalities, which covers about 521 municipalities in Brazil, and it started last February of this year. Last year rather. So initially they were able to give out already 1.5 million doses. So amazing. Brazil were very much heeding the call and the need for dengue prevention, and they've started it very strongly and boldly. Another one is a dengue vaccine that has been used in the local dengue in East Kalimantan, Indonesia. So again, one of our neighboring country who experienced the same burden of dengue diseases that we have. They have started with 10,000 doses for elementary school students grade 3, 4, and 6. And the first dose was completed last February 2024. And looking at the posology or how we're giving the vaccine, they've already completed it. So first dose, February, the second dose comes after 3 months. So I'm sure they are now looking at the post-marketing surveillance. They're now looking into monitoring these patients who were given the vaccines. And the thing is, there are no important risk issues, so the vaccine has been well tolerated. So in summary, increased dengue cases worldwide as a result of climate change, with the Philippines had the highest number of cases and deaths in the ASEAN region in 2023. So that's us, the Philippines. Several provinces and cities declared state of calamity because of the significant increased number of dengue cases this year as compared to previous years. They have declaration, they have moved into creating groups. But then again, all this would probably fast track if we really have a set of integrated response, such as vaccination, that would help prevent the disease. And of course, our LGU efforts to prevent and control dengue includes the 4S strategies as well as the awareness campaign in the barangay. So just to rehash on the 4S, that is search and destroy. You have to seek consultation from your consultants, and then you have to self-protect and say no to indiscriminate fogging. And the WHO called for a multi-pronged approach to dengue vaccination or prevention, and control dengue through immunization, since there is no specific treatment for dengue. So as a pediatrician, particularly a pediatric infectious disease, I also advocate immunization as part and as a stronghold for the intervention in terms of dengue prevention. And several countries have already implemented dengue immunization as part of their public health program. So there's Argentina, Brazil, and Indonesia. And hopefully in the Philippines, we can start once approved. So thank you very much. I'll be happy to take your questions later.
Thank you, Dr. Delta. So please reserve your questions for open forum later, no? Dr. Delta stressed a lot of points during her lecture. And so without further ado, kasi we have two more lectures kasi. So I'd like to call on our second lecturer. So this time we'll focus on the local dengue situation here in Davao City, and to share the latest data and our ongoing efforts to address this public health concern, I would like to introduce our second speaker. So she earned her medical degree at the Davao Medical School Foundation, had her fellowship training in Pediatric Critical Care, also in UPPGH. So currently she holds the medical specialist 3 position. Dr. D, are you the head of the training? Okay. So she's also the head of the fellowship training in the critical care, pediatric critical care, chair of the fellowship training for pediatric critical care in Southern Philippines Medical Center. And she's an associate active consultant of the Department of Pediatrics, also of Davao Doctors Hospital. So please help me welcome, I fondly call her Dr. D. Please help me welcome to the, in our lecture for this morning, a round of applause for Dr. Dadia.
Thank you, Dr. Montilla, for that very kind introduction. Okay. So, good morning, everyone. Ay, afternoon na? Noon. Okay. So, from the national, let's go to our regional data. So, I would just like to give a background that the Southern Philippines Medical Center is one of the 7 hospitals in the country who was chosen to be the dengue center of excellence. So what is Dengue Center of Excellence? It is a tertiary health facility that can provide services, leadership training, best practices, research, policy recommendations, and technical support for clinical management of dengue cases. Actually, we have 4 phases. So next slide, sorry, Doc. So enhancement of service delivery and component and development as a training center. Then conduct research and technology transfer. Actually, in coordination with the Davao Medical School Foundation, there is an ongoing research on metabolomics. So we're trying to look at the dengue severity scoring to prevent and to assess whether the patient can go into severe dengue. So we also have to act as an information center. And lastly, health policy advocacy. So next slide. So this is we have to improve our absorptive capacity, equipment, and human resources, and our goal is to reduce the case fatality rate below 0.1% within a 5-year period. So next slide. So these are just the objectives of the 4 phases. But however, it's not because we are finished with the phase 1, we have to forget about it. So it's always simultaneous, the training, the research, and acting as an information center, and of course, the development of policies. So next slide, Doc. So these are just the objectives of the different phases. And then next slide. So this is just an geographic overview of Region 11. We have 11 congressional districts, 5 provinces. We have Davao del Norte, Davao Oriental, Davao del Sur, Davao Occidental, and the Compostela Valley, or the Davao de Oro. And then 1 highly urbanized city, which is the Davao City, 5 component cities, 43 municipalities, and 1,162 barangays. And these are our goal for the program: decrease morbidity by 25%, mortality by at least 50%, and of course the case fatality rate to 0.1% or less. So actually, based on the 2024 data, we have 28,397 cases from January 1 to December 31, 2024, recording 163 deaths. So with regards to our cases, we have 40% increase from January 1 to December 31, and 19% increase of deaths compared to the same case in 2023. And according to our data, majority were males, and most of the cases fall below within the age group of 5 to 9 years old. So let's look at the data further. So as you can see, Davao Occidental has the highest increase in cases at 110%, followed by Davao del Norte at 106%. And as you can see, it's only Davao Oriental which saw a negative decrease. So there's a decline in their cases by 33%. So next slide. So as you can see, the highest number of deaths was recorded in Davao City at 58 deaths. And that's why we have to work on this one. So next slide. The blue line here is the alert level threshold, and this is the epidemic threshold, the red one. And as you can see, our cases is above epidemic threshold already here in Region 11 for the year 2024. So next slide. And comparing it from 2019, as you can see, there is a decline during the pandemic, but there's a slow rise, and now by 2024, the cases were above the 2019. And the week 33 is the highest, so it's usually the August season. So June, July, August, so that's the rainy season. So as you can see, there's a high number of cases. That's comparing to 2023, there's a market increase in 2024. And as you can see, as I've said earlier, the 5 to 9 years old were highest, that's where the highest number of cases fell, and then followed by the 1 to 4, and then you have the teenagers, 10 to 14, 5 to 19, 15 to 19. Regardless whether you're a male or a female. Okay, so with regards to the case fatality rate, as you can see, the highest is Manay, followed by Governor Generoso. So there's just 2 deaths, 3 deaths, but the computation of the case fatality rate is a number of deaths divided by the total number of cases. So that's why even if they only have 2 deaths and 58 deaths in Davao City, the Davao City, because of the high number of cases, has a lower case fatality rate compared to these areas. Also, I think Tagum has 12 deaths and still lower case fatality rate compared with Compostela and Bansalan, for example. Next slide, Doc. And then it's Monte Vista, City of Panabo, and Lupon with lower case fatality rates. Okay, let's look at the dengue census in the Southern Philippines Medical Center. Since it is the center of excellence, so we compare the data between pedia and adults, and the pediatric population has really a higher cases compared to adults. So next go. And as you can see, there's a rising number after the pandemic. There's a rising number of cases, with highest recorded in last year, 2024. And in 2019, as you can see, as I have mentioned earlier, it's really this June, July, August season with a noted increase in the cases. Then in 2020, I think it's only in 2020 where you have a very high increase in January and February. 2023, as you can see in 2023, there's not significant decline anymore. As Dr. Delta has mentioned earlier, the dengue now is really endemic. It's no longer seasonal. So next slide. As you can see here, there's a steady number of cases, although there's an market increase last August of last year. And as you can see, this is 2024, since pandemic, there is really a market increase in the number of cases last year. So that's why it's very alarming. We'll never know the cases this year, but we really have to strengthen our preventive programs. So for last year, Sige, next slide, Doc. So these are the cases and the number of tested cases. As you can see, among these cases, whether it's positive or negative, we still go clinical when it comes to managing dengue. Although, as you can see, there's a higher number of negative cases, but these cases were still managed as dengue cases. So next slide. So it's really the July, August, September, which has the highest number of cases. But as you can see, there is not much decrease. So the cases were still patients with dengue admitted were really maintain the number. They're not declining that much. And based on the data, the 5 to 9 years of age still has the highest number of cases admitted, followed by the 20 and above, as opposed to the region-wide where the 1 to 4 years of age came in second. So next slide. And as you can see here, last October still, the highest is the 5 to 9 years of age, followed by the 20 and above. So majority were males because dapat yung males should be the so here is the so the males are always majority compared to the females because ang males daw are always outside compared to the females. Oo. Laagan. So as you can see here, there's a high number of cases during July, August, September, and also the highest number of deaths at 21. Okay, and still the pediatric population is highest. And as you can see, among those who died, majority of them tested positive. Okay. And then, as you can see, no, the Barangay Buhangin, Talomo District, we have to watch out these places because we have the highest number of cases of dengue. And as we compare, no, from 2022, 2023, and 2024, there is an increase in the cases during this pareho pa rin, no, August, September, and then July. So next. And among this, according to this data, the highest number of cases were recorded in 2024. So there's a steady rise from 2022, 2023, and 2024. So we're really, the Southern Philippines Medical Center really trying to clean the environment of the hospital itself, no? And the next, so these are the housekeeping mosquito spraying for 2024. So regular ang paglinis just to mitigate and prevent the further spread of this disease inside the hospital. So next yan. Next. So ito yung mga nililinisan ng mga lugar inside the hospital. Okay, so medyo marumi talaga po, no? So ngayon kasi, di ba, 5S daw kasi we have added sustained hydration as part of the prevention. And we have the SPMC Dengue Action Plan, no? We just have to show it. We're trying to strengthen our health promotion. And the next, no? And advocacy and engagement with the community, which the media can also help us. So strengthen dengue prevention and control. Then, so this is an all-year project. So you conduct training and reinforce dengue surveillance. And next slide, though. For the Department of Health, we have created the following pathways, no, clinical pathways that will somehow help us with the management of our cases. So how do we manage patients with cardiac problems, cardiac involvement? Because dengue is currently a multisystemic disease, so we're trying to have a multisystemic approach to our management. So for cardiac, and then we also have, next slide, Doc. So renal, and then, sige daw, Doc. So we have to have a systemic approach. Next, Doc. And then next, Doc. So we also have GI, so liver pathology. So what are the diagnostics? How do we define the cases, and then the management? And then the home card. So those who goes home, especially in the OPD, should receive this card. So they will have an early seeking of intervention should warning signs occur. Of course, the Pasyente project, which will be discussed further, sige daw, Doc, next year, by Dr. Cinmayli. Okay. So I hope this will will make use of the artificial intelligence so that people will go to the hospital, because that's one of the problems that we saw in dengue. So I hope that with everything that we have discussed will somehow help prevent dengue deaths in our locality. Okay, I think that would be all. Thank you so much.
Thank you, Doc D. No? So, indeed, dengue has been really alarming. No? Lagi kaming nagkikita nito ni Dr. D sa mga forum. As mentioned by Dr. Heralde, we call ourselves the dengue warrior. So, we discuss a lot of things. So, I'm sure, Dr. D, that everything that you mentioned will help our friends here understand our ongoing fight for dengue. So, for our third speaker this afternoon, I am delighted also to introduce to you that she's from the academe, who will talk about a web and mobile-based application designed to aid in dengue screening and provide support to our patients. So this project is a collaborative effort aimed at improving healthcare delivery, especially for patients suspected of having dengue. So our speaker is an associate professor of and the department chair of Mathematics, Physics, and Computer Science at the University of the Philippines, Mindanao. She is a Doctor of Philosophy and Computer Science from the National Sun Yat-sen University in Taiwan, and she led several innovative projects, including that of the Pasyente project for dengue, which is funded by the DOSCPCHRD. Please help me welcome Dr. Cinmayli Manliguez.
Thank you, Doc, for your very generous introduction. So this morning, Dr. Aguilar and Dr. Dadia has already presented us the national and the local context of the situations of dengue. And in this fight against dengue, I've heard that our team, the Pediatric Society team here, call themselves dengue warriors, and we are very grateful and honored to be part of this media roundtable activity or event. So in our fight against dengue, we also need to look at various lenses, and it includes the patient level scale. Okay, and in please, next slide po, Doc. So in Davao City, actually the City Health Office, they mentioned that 90% of the dengue deaths could have been prevented if patients went to healthcare facilities sooner. And this really showed us that improving the health-seeking behavior at the patient level, okay, could break the barriers, and especially in healthcare. And this includes also the set which most of the people in the low and middle income countries have in their parang nagiging prinsipyo na nila, no? And I quote, they said that I go, I die, I stay, I die, better to stay and die in my house. So it's saddening, to us researchers and even to the doctors, to the dengue warriors, that people have this kind of mindset, especially sa kanilang health. And we aim also in the Pasyente project to eradicate this kind of mindset, to overcome this kind of barrier. And so we present to you the Pasyente project for dengue. This is the first in the Philippines that utilizes AI and operations research for the mobile and web applications. This one is funded by the DOC, Philippine Council for Health Research and Development, and we leverage the expertise in health decision support systems, computer imaging, operations research, modeling, health informatics, telemedicine and telehealth, data science, artificial intelligence, and epidemiology from yours truly, doctor or Ma'am Chin, pwede niyo kong tawagin Ma'am Chin po, no? Kasi hindi naman ako medical doctor. Manliguez, and also Dr. Raymond Sarmiento, if you are familiar with him, he is the director of UP Manila National Telehealth Center. So we know that can contribute bigger impacts to our society and community if we partner, if we engage our dengue warriors, our experts, industry experts in this fight against dengue and in this project. So we have our list, but marami pa po, no, of dengue defense experts who help us understand the mechanics of dengue as a public concern locally and even internationally. So nandiyan po yung City Health of Davao, the Southern Philippines Medical Center as presented ni Dr. Dadia, the Department of Health, Davao Region, the Takeda Healthcare Philippines Incorporated, Buhangin Health District na nakita niyo sa data kanina na nasa top po siya, sadly, no, sa ating number of cases. And the Dengue Task Force in Davao City, the health centers at Buhangin, the Disease Watch and Analytics of UP Mindanao, the USCP, even the DICT, and other organizations po. And we are really thankful to these organizations because they are in our way forward in the fight against dengue. By helping patients that help dengue patients make smarter decisions. And this is through our Pasyente web and mobile application, where our patients thrive and healthcare professionals excel with our mobile and web applications. So we have these three main features for our mobile application. So we leverage the power that is being inherent in artificial intelligence, and this is by providing a pre-diagnosis of the patient's symptoms. They can input their symptoms as they arise, and they will know their current status right away, maybe in a few minutes or seconds, depending on the internet connectivity, and immediately see the list of facilities available to our patients. The other main feature is also research. This is through operations research, and will be able to get a rank of list facilities based on their preferences. So we know na merong mga barriers talaga in healthcare, no, especially at the individual scale. So they might have these preferences, gaano kalayo, they might prefer na mas malapit, bahalag unsa ka mahal kaya nila, no, they might prefer farther, basta mura lang yun siya, or zero yun imong mabayaran. So how far, how much, and how long they have to wait, even the waiting time. And we can also see yung last feature, how long they have to wait, okay, when they arrive at a certain hour. And then our last feature is also we want to improve seeking behavior by being connected with their doctors even if they are being monitored at home. So with this one, they can update their doctor from their home about their status, symptoms, and they will be notified when it is at the time for them to update. And they can also see their previous remote symptom logs. And of course, kung meron tayong app for the patient side, this is the mobile app, meron din naman tayong Pasyente web. This is for the patients and our healthcare workers. So with this counterpart, they can manage the patients and appointments effortlessly. We also have a centralized patient records for them to unify their patient records across facilities. Because they are already gearing towards the universal healthcare. And this is one of the tools and the technology that is already leading to that from the patient level, from the household level. Unlike mga current na mga information systems existing today, they are at the hospital level, at the clinic level. So we want to bridge the gap, no, from the individual household level to the hospital level. And last is outpatient monitoring. So isa rin sa aming mga driving forces is the alignment and our contribution to the United Nations Sustainable Goals Development. Number that is good health and well-being. Number 9 is innovation and infrastructure. And of course, sa alignment din namin sa DOH 8-point agenda na agenda number 3, teknolohiya para sa mabilis na serbisyong pangkalusugan. And as I have also mentioned, our partners are really, hindi lang sila collaborators sa aming, they are really inspiring us, giving us motivation to continue and to do our job excellently sa aming Pasyente project. So they were involved in our soft launching. They have given us really generous in giving us insights how we can improve, how we can further, parang future looking na talaga sila, no? Even the expansion part of the project are really came also from their insights. Yeah, so we are also thankful that they involve us in their activities. So it's one of the activity of the City Health Office. This is with the Dengue Task Force of Davao City, our community, and we are overwhelmed by their support, and gaano karami rin yung mga Dengue Task Force natin dito sa Davao, no? And yan yung roadmap po. So currently, we are at the updated yung date, no, but we are in the validation state or phase of our project. So our research team here, our development dev team and technical team are already in SPMC. So kung nandun po kayo sa SPMC, makikita niyo itong mga phases na ito. Nagkakandak na po kami ng validation of our app. And we give the app freely as of now to the patients and healthcare workers and physicians also for them to test the application. And we would also like to share a sneak peek of our, yung sinabi ko kanina, the expansion of the Pasyente project or Pasyente apps. This is the Pasyente Plus surveillance. So from our round discussion with our partners, they are able to give us really meaningful insights that we can further improve para hindi lang naman yung physicians and the patients ang maka-benefit, but even our LGUs, because they have seen how valuable the data that they can obtain from our application, especially from the household level po talaga, no, from the individual level. Unlike other data that they are collecting right now na from the hospital siya, and it will take them weeks for the reports to come in. And with this, there will be real-time mapping of reports. We can connect to confirm cases faster, and with that one, LGUs can provide their mga dengue kits nila, medicines, and ano pang kailangan nila, pwede nilang gawin, no, to the faster. And hopefully at real time na siya, no, with this application. And access to facilities in, focus muna in Bunawan and Kalinan where dengue cases are also high. And with that, we would like to relate to you, kami po sa academe, mga researchers, developers. So what we do at the university is not to the real war that you are facing, no, as the dengue warriors, being by you. Okay? Every day, you various types of diseases and public health. Dengue is just one of these public health challenges. And what we can only offer to you are these battle tools, our Pasyente web and mobile app. That's from our Chancellor Muro from UP Mindanao. And I encourage and to let us build this together for smarter patient decisions, quality healthcare to all. That's all po. Maraming salamat. Ayan.
Thank you, Ma'am Shin, no? So truly your work is actually commendable. Alam nyo, when you say that it is based on artificial intelligence. When I first heard about it, nag-misfire ang aking neurons. Hindi ko talaga siya maintindihan. Ang hirap intindihin, you know. The concept behind the artificial intelligence is really very different. And then, pag nagva-validate pa kayo, sabi nyo, you started a study, right? And the validation takes really a long time, no? Matagal siya. So truly, this team is commendable kasi we came up with an app, no, for us to easily understand. I hope we can understand it also kasi the basis of you building it is really very difficult, no? So congratulations to you and to your team for coming up with this kind of, you know, app that we will be hopefully be able to use to be able to extend that to help to our patients also, for patients with dengue. Kasi it's always a high index of suspicion that will tell you, uy, baka dengue nga. No? And then with us using this kind of application, then it will further help us with the screening also of our patients. So ang dami ko nang sinabi, Sir Sito. So we are now at the point wherein our friends from the media will be able to ask our panelists here in front, Dr. Adelta, Dr. Diana, and Ma'am Chin, for your questions. Sir Sito will be facilitating this part of our program. Thank you.
Thank you, Dr. Joe. Just a quick announcement. We'll do a quick run of a Q&A. After that, we'll go for lunch because we're really sorry that we took your Sunday. I personally do not want to work on Sunday. I promise that to the Lord, but I think what we're doing here is to save lives. So we'll do a quick Q&A, have lunch, and you can just ask our experts during the break, during the lunch, if you have follow-up questions, okay? So like I said, this is not a press conference. This is bringing in the media to be part and become dengue warriors. This is for you, not for anybody, okay? So would anyone like to be the, okay, Carlo, you can be the first. Please identify yourself and then do your quick question.
Alright, thank you so much, Sir Sito, for introducing me as the first to ask at this. Good afternoon to our honorable and distinguished guests. Just a quick question to reserve for other media. No? Just like to give specifications of the misconceptions. Kumbaga, it's either the both of you doctors would answer this because there are a lot of misconceptions that even up to now, there are people who had to take the risk of medicating themselves in order to prevent dengue. But is it highly discouraged po that they would usually do to drink tawa-tawa or durian in terms of that? Because even up to now, they couldn't handle the situation for that kind of, in order to relieve themselves from dengue. It's you can answer.
So as far as medical studies are concerned, there has not been any proven effect on the use of tawa-tawa or the intake of durian in terms of dengue prevention. So these are passed on hearsays and sort of folklore that has been passed on and has been continued on because they thought probably coincidentally it had helped them, but technically speaking, medically, there are no scientific basis on these thoughts.
Okay, Gio?
In addition, no. So I just want to, because you're talking about misconception, so contrary to previous notion that dengue is a platelet disease, it is not. And we see that because currently dengue is really a multisystemic disease. That's why in our management, we have to look at different organs because there's an emerging dengue syndrome, expanded dengue syndrome. So it does not follow the natural course of dengue. And then when we see them, they're really toxic and is bound to die, and that's why we want to prevent. And then the Pasyente project is here to really improve the health-seeking behavior of these patients. And then with regards to tawa-tawa and durian, the current guideline, the 2023 guideline, they advocate for the papaya extract, but not the durian, not the tawa-tawa. So that's based on the latest guideline, no? So, but I've not seen a lot of people using that. So, but it's based on studies, it can increase the platelet, but as I've been saying, dengue is not a platelet disease, but rather we have to look at the multi-systemic involvement and the increased risk of mortality. That's why if you can help us really inform people about the improvement of their health-seeking behavior. Thank you.
Okay, Dante.
I just want to follow up, ma'am, sa sinabi niyo kanina about the... I am Armando Penegito from Radyo Philippine, Davao. Follow up ko lang po yun kanina yung sinabi niyo about the dengue immunization. Is it right? Is it now the high time to push for dengue immunization? Since sabi niyo nga kanina with Dr. Dayan, sinasabi na hindi na siya seasonal disease. It's already a parang endemic na siya, yung all year round na siya. So is it really a high time for the Philippines to have this vaccination?
I'd like to think that we have to be not just outbreak driven. So it is high time because it's there, it's lingering around. We don't need an epidemic, we don't need an outbreak just to push for the vaccine. Since it's there, the problem is there. I think the best way to educate and also to prevent, again, as WHO would want to say, is the administration of vaccination as part of the integrated management. So it's high time now. We cannot delay it because deaths are coming.
Okay, next table.
Regine Patongbon po from San Davao. Still to Doc. Regarding the push natin for vaccination, there's still a lot of parents po kasi that are hesitant. Even the immunization for their children, they are very hesitant na din. Tapos, we have the previous case of dengue pa. How will we encourage them po to siguro to allow their children to get vaccinated or sila mismo to get vaccinated?
Okay, so part of our responsibility as pediatricians to also educate the moms, and the moms to be able to open a good communication. They can ask us on whatever issues they wanted. And I agree with you on the issue of vaccine coverage. It's really very poor. It's very hard to convince people, especially after the fiasco. However, sometimes those victims, those families who went through the curse of being able to take care of a dengue victim or a dengue child, we don't even need to talk about it. They're the ones asking, Doc, is there any other way to prevent this? What about the vaccine? There was an available vaccine. So I think the best thing is that healthcare providers should be the first to encourage and open up conversation about this. We need to respond to questions of parents as well. Education, awareness, I think that's our major strength, and we would want to continue doing that. And of course, the works of the Philippine Pediatric Society, not just on the national level, but also in the regional. We've been doing this caravan whole year round. So we hope that we somehow reach other people and that they'll be open up to this intervention.
Last two na lang po. Doc, I'm just curious po, how much po ba ang vaccine? And then, if ever the Philippines will procure these vaccines, will we be able to afford it? Or kailangan ba magbayad ang mga tao na gusto mag-avail, ani?
Okay, so I'm not in the position to talk about the cost, but I can just share what I've also read from the net. So since this is not something new from other countries, so let me just give you maybe a point view of what I've read in the internet. So for example, in Sweden, they are selling it around 200 euros. That is in the private level, okay? In Thailand, I think some of the travel agencies, yung mga tinatawag nating travel medicine clinics, they are selling it for about 1,700 baht. So it really depends on the area. So we don't put a label or a cost because again, as it is right now, we don't know how much it will cost yet and if the government is willing to pay for it, or we would want to push that if the government is not willing to pay, then those who can avail, those who can pay and willing to pay, I think it has to be offered on that level.
Thank you, Doc. To Doc Diana, last na lang sir, sorry po. Sir, Doc, for us kasi sa media, I don't know if the same with my colleagues, is that we really have a difficulty comparing statistics. We have statistics from DOH and then we have statistics from SPMC. And sometimes, na-adjoy difference or disparity between data. Is there, ano ba yung pwede namin especially for us, we're informing the public about it. Sometimes dili same ang kaning data on both sides. Is there any way for both agencies to
Actually, we have a quarterly consultation. I think if that is your issue, I think I can actually brought that up, no. And we know each other, the DOH and the SPMC. And the SPMC is very concerned with the data in the hospital. The DOH is region-wide. So everyone will submit based on reso. So mayroon man yung surveillance unit. So may regional. So I think I have to tell Ma'am Kix about that. So thank you for bringing that up.
Thank you. Thank you.
Just additional info for our friends in media, no, regarding the vaccine. I know at least one media couple, and I know some people in the advocacy who have gone to Bangkok. Nagpapabaksin na sila. Hindi na. One is Karen Villanueva. She posted it on her website where she said, I already went through this. I am not going to go through it again. So she went to Bangkok and she had vaccine. So 1,600 baht, baka mga 2,000 pesos lang yung day. Ha? Hindi, magsha-shopping ka naman eh. So hindi nakasali yun. Wala na sa equation yun, okay? Anyway, so that's one particular case. And then regarding the statistics, this is what's beautiful about our engagement today. Because now, I think our friends in media have access to experts, even with the PPS. Please get their numbers. Because you will not get the statistics all the time. I have a running quarrel with the DOH leadership. Inis na sila sa akin. But I said, it will get to the point, I will put the numbers on the front page of the Philippine Star and pay it by myself. Kasi, walang makuha data eh. So, you go to the experts. And the exercise today is to create direct links. Wala nang pupuntang iba pa. Okay? May I go to the gentleman there? Ay, hindi, nauna siya. Sorry, Amy.
Mababa. Ayan, good noon po to our medical experts from PPS and from SPMC and to the OSC and to all the media colleagues here. Our favorite medical and magical quote is prevention is better than cure. So, napakahalaga po niyan, Doc and Ma'am and Sir. So, sa ating pong napag-usapan na kanina ang immunization and vaccination. So, aside from that, so this is a general question na lang po para masagot niyo po isa-isa. So, ano pa po yung pwede nating gawin aside from vaccination para ma-inform po natin yung public about this na napakatagal na pong problema na unahan pa ng COVID vaccine ang ating dengue cases or dengue problem dito sa Pilipinas. So, yun nga, na-mention niyo po kanina na yung ibang bansa ay meron na silang mga vaccine, pero dito sa Pilipinas dahil nga po sa nangyaring Dengue na talagang maraming namatay because hindi po nila alam kung paano yon ang tamang paggamit ng vaccine na yon. So, sa ngayon po, dahil kayo po ay nasa private, paano po natin makipag-ugnayan sa ating public na government agency like DOH and PhilHealth para ma-resolve po ang problema na ito once and for all po?
I'll answer first. Okay, so I think it's very important to inform and educate the public on the early timing detection, and then that would go for management thereafter. Early timing and detection. Ibig po sabihin, kung ang bata may nararamdamang fever, 2 days or more, kumonsulta ng doktor. Okay? Do not self-medicate because then again, in Davao City, it's very endemic. Your 2-day fever may not be just the normal flu, your tonsillitis, your UTI, it may be dengue or it may occur both. So we always tell them, please be more vigilant. Okay? 2 days of fever, consult a doctor. So that's one thing, early detection and management. Next, of course, I cannot overemphasize the need for vaccine. Third is a sustained vector control. So this is not already something that I can reiterate. It's something that the community, the government has to do. So it's vector control. Singapore has very good vector control. That's why their cases are down. That's why sometimes they only advocate one type of vaccine, or they just have to choose which vaccine they like, okay? So they have a very good control. Next is surveillance. So apparently, we do have regional, national surveillance, but this is something that we get from 3 months past, 6 months past. It's not active surveillance. It's passive surveillance. So we report because it has been done. But active, we don't have. Yung gusto natin, kung nakikita nyo sa internet, lalo na nung time ng COVID, pag open mo sa net on the world COVID, yung numbers nag-change every day. So sana we have that kind of surveillance form. Okay? So these are just among those that I can share.
Thank you, Doc. No, pero I just want to emphasize that the problem of vaccine hesitancy is not just for dengue. As you can see, we have problems with measles vaccine. So it's really a drive that we pediatrician has to really advocate. And then, with regards, I just want to expound on the vector control. I don't know if you have heard of Wolbachia phenomenon. So you have a bacteria that's injected to the male mosquito, so that once that male mosquito would mate with the female, so the female will not hatch eggs. So, kasi ang ano niyan, kung walang lamok, walang dengue. So, hindi lang naman dengue, lahat ng mga vector-borne diseases pwede ma-prevent. And I hope yung sana sa UP can study on that and then help our government. Kasi I've been advocating dengue prevention for so long already. Kami na Dr. Mantilla, grabe, sila Dr. Heralde, grabe yung ano namin. Si Doc Sally, na dumating pa kami sa Mati para lang educate, pero to no avail, marami pa rin cases. Because I think, di ba, wala tayo dito ngayon kung yung COVID vaccine hindi siya successful. So sana maging successful din ang dengue immunization, because I think that's the best way to curb down the cases. That's from my opinion.
Siguro ako, what I can share is one of our learnings din po in our journey sa Pasyente project. So, we are really thankful that we've been involved and we've been invited by different na mga stakeholders din namin and partners. And during our, actually, if I may share, no, na kami po yung parang the only one in Mindanao who were invited to present our research project and have an exhibit during the Access to Medicine Summit in Manila and to the first Dengue Summit, Philippine Dengue Summit po. So with that, no, we have learned na this problem, this fight against dengue is not just a problem of one society, one expert, no, it's multi-sectoral, and I believe na we have already set some measures. Kailangan lang siguro empowerment, nandiyan na yung 5S, meron na tayong dengue task force, marami tayong experts, we have the technology, but we have to help one another. It should be community-based, just like what we did and how we started our project. It's collaboration-based. Hindi namin sinimulan yung fight against dengue with our own knowledge, our own expertise. yung skills lang namin. We need the help of our doctors in the domain and the community, yung mga warriors talaga na nandun talaga sa field work. Kami, nandun lang kami sa offices, nandun lang kami sa harap ng computer namin. So we really need that community-based siya na engagement. And also, yung collaboration din. And of course, as part of yung advocacy rin namin sa aming project is, our project is patient-centered. So we really look into the need of the patient, to the need of the individual. And one of the barriers natin is yung health-seeking behavior. So yung na-mention nila, Doc, na awareness, education, from the experts, from the parents, even to the children themselves. No, they should also know what they can do for them to stay healthy, to keep themselves healthy. So lahat ng miyembro po sa community dapat involved po in this fight against dengue. Hindi lang siya isang sector and hindi lang isang problema. So yun po, and lastly po is of course, meron tayong teknolohiya. So nandito si Pasyente web and mobile apps. We will be useless if we will not be supported and adopted by the government or a sector. No? So hindi masusustain din yung project kung wala rin yung suporta and adoption of this technology. That's why we are collaborating in partnership with SPMC, DOH, and other sectors din also namin para to strengthen din yung adoption of the technology that will help us aid this problem.
Thank you. Amy? While Amy's working her way to the microphone, I just want to react to your comment that maraming namatay. Okay? Maraming namatay sa dengue. Okay? Now, let's be clear about this. Last year, the official count was 881. Okay? The unofficial count is over 1,000. Okay? Now, as far as Dengue-related deaths are concerned, I shared a document with Jim Ray that I encourage the members of media to read, because I went through the pain of reading 70 deaths manifested in the Dengue cases. And I discovered one by one, at napilitan pa ako mag-Dr. Google para lang ma-translate kung ano yung mga actual causes of death. Most of them died from tuberculosis. They had hydrocephalus. They had bone disease, severe bone disease, malnutrition, pneumonia, sepsis, etc., etc. If you read that document, you will find out the comments of the DOJ panel and why they threw out the cases. Because I'm raising this to our friends in media because itong anti-vax mentality ginagamit na panggatong yung dengue siya. And it has been a lie proven by the court and substantiated by the Department of Justice. So it's with Jim Ray. I'm sharing it as a media to media. Amy?
Yes, good afternoon to our fellow doctors. According to the World Health Organization, that there is no specific treatment for dengue. How does the dengue vaccine contribute to the global fight against mosquito-borne diseases, Doc? And how effective is the dengue vaccine in preventing dengue infections?
WHO reiterated that there is no specific treatment because we only relate, as mentioned earlier, it is a multisystemic disease already. So if you look into one organ system, it's not yet enough. So there really has to be a collaboration of mostly subspecialties. Now, how can dengue vaccine decrease the burden of the disease? For one is it can protect the lives, it can prevent the transmission. So all of this, when done together, it will reduce the burden of dengue infection. Now, the other question was the efficacy. I think you're looking into that.
Yes.
So based on the data on the second generation dengue vaccine, they say that the overall vaccine efficacy against vaccine confirmed dengue is about 80.2%. And long term and against a severe infection or severe hospitalization rather, or severe disease, it's about 90%. Now, in terms of long-term protection, we see that it is also vaccine efficacy was noted at around 60%. Tama ba, Doc? Or vaccine efficacy in terms of long-term protection. 60%, and then for severe infection, that's when you say long-term protection, that is after 4.5 years nang nabigay na yung vaccine, ha. And then for the long-term protection on against hospitalization, it's about 80%, 84%. So these chances, these numbers are arbitrary, but again, that is versus zero kasi wala kang protection. So as a person and as a doctor, where will I put my, let's just say, bet? I will bet on the chance that there is somehow a future of me getting well rather than not fighting at all.
Additional question, Doc. What are the differences between the dengue vaccine and natural immunity after recovering from dengue?
Okay, so, that's very technical. When we say dengue vaccine, you put in antibodies on your body so that you'll be able to prevent the disease. When you say natural infection, you get the disease and then develop the antibodies. So the thing is, paano kung hindi ka pa nakagat? Okay? So this vaccination is already protective for you. Hintayin mo bang magkasakit ka muna for you to mount that protection? What if yung isang sakit mo na yun would cause your death? So, do you need more time for that? No need. Now, this is a vaccine preventable disease, and vaccine is one of the answers to prevent it. So, for me as a doctor, I don't need to wait for my natural immunity to come because that timing might be preceded by the infection.
Last question, Doc Pat. I'm also interested with this one. Several countries, it was mentioned earlier that Brazil, Argentina, and our neighboring countries in Southeast Asia, the Indonesia, have implemented dengue immunization. In the Philippines right now, is there any vaccine that already been in process to be approved by the FDA or the DOH? Or what are the brands of this dengue
In terms
vaccine?
of dengue vaccine, no, not yet. So the ones this second generation is under FDA approval. So we are still waiting for the approval.
Is there any challenges that we are facing with that?
There are a lot of challenges. Definitely, this vaccine approval has been there for more than 22 months, and we have not heard any word, or I'm not sure. I think Sir Cito can expound on that issue. So, as doctors, we're waiting for the approval as well.
Like, this is a direct to the point question, Doc.
Yes.
Is the government supportive about dengue vaccine?
Oh, that's very political as well. Okay, so how do I answer that? I think we would want the government to hear us. We doctors are still seeking for the approval from our government. So in that line, maybe we are still in the process of convincing them. So I cannot say that they are against it or they are for it, but maybe they're still in the process of really studying.
Thank
Okay.
you, sir.
Thank
Safe
you,
lang yun,
Amy.
sir, no? Safe lang.
No, for the record, because it's actually not the doctor's field of authority, but for the record, the Philippine Medical Association has submitted a letter that has been publicized, shared with the media early this week, to the Office of the President, asking the President to look into the matter and to help facilitate the approval of the vaccine because of the pre-existing conditions. So that's where it is. We are hoping that this second generation vaccine will be approved because at the end of the day, it's about saving lives. Next question. And then siguro after this, we can have lunch na. At yung mga doctors din ay may mga magra-rounds pa.
Good morning, everyone. This is Nova Francas po from Mindanao Times. I'd like to ask this question to Doc from SPMC. you mentioned earlier about this particular initiative wherein yung bacteria na ano sa mga male mosquitoes, because I learned this this is also an initiative from the OST PNRI about those yung i-sterile nila yung mga male mosquitoes, and it was found to be effective in somewhere in Guimaras. So have there been like any ongoing talks with the DOST to do that in Davao City or in the region po?
Actually, it is one of our programs, the effectiveness of the vector control. Kasi hindi lang yung nag-spray lang. So, kailangan talaga natin na wala na talagang mosquito. And I think Dr. Chin here can actually help us with that, no? Kung sila kasi yung may technology. So, the DOH can have the initiative, but we need the technology of the DOS.
Yes po. So, currently, or I think recently, there were also research proposals on the study of Wolbachia. So we are, I think we are reviving the proposal in this coming year, and we have the facility also in UP Mindanao to support this kind of research. So siguro abangan natin in the next few months yung implementation nito, and for sure the DOH and SPMC will also be involved in this kind of research.
In that case, ma'am, we also have to consider the parang survival ng mga male mosquitoes when they will be spread out to mate with the females. I'd like to ask about this. Is it ongoing na po ba yung parang?
This is still a research proposal. So, yun, abangan lang natin pag naano na siya, approved na po and funded na siya by DOS.
Okay.
Okay po. Ay, one last question na lang po, sir. There's a barangay ba yun in Mandaluyong where they offer bounty in exchange of yung yes, for the mosquitoes. Do you think this will be an effective program po? Thank you.
Bounty yun, pero 1 peso for 5 lamok. Sino ba naman maghahabol ng lamok? Siguro kung 100, kailangan mo ng 500 lamoks. I mean, I think we really need the technology of Wolbachia instead. Instead of yung ganyan na bounty, we need something that is effective. Kasi yun lang yung drive nila, pero I'm not sure in the long term if that will really hold true. Oo. Baka makagat pa yung naghabol ng lamok.
Well, actually, in fairness, no, it's a very valid interest, because from a communications PR point, yung ginawa sa Mandaluyong, sa Addition Hills, brought attention to the problem. Sabi nga ng iba, we are so desperate, we will try anything. Now, as far as the how do you call it, sterilization of mosquitoes, the original concept, if I'm not mistaken, originated from Singapore, and it was in laboratories. It was funded. Unfortunately, the DOST has very limited funding, so it remains as a research proposal. And second, the problem with that concept applied to the Philippines is, unlike Singapore, which is an island state na maliit, parang mas maliit pa sa Quezon City, definitely much smaller than Davao. Okay, the Philippines is 7,000 islands. Sabi, we can kill here, but nature will propagate here. So it becomes economically unviable. Anyway, thank you very much, doctors. Thank you to our friends in media. Thank you to the Philippine Pediatric Society here in Davao. And let's now go for lunch. And I pray that the Lord will bless the food. Bless the food, and thank you for your Sunday. Dr. Joy, all yours.
Thank you, sir, for facilitating our Q&A this afternoon. No? Kasi I was afraid na ako ba mag-screen ng mga ano, hindi pala. So, thank you sir for facilitating our Q&A. And I cannot thank our panel enough for our open forum this afternoon, Dr. Adelta, Dr. D, and Ma'am Chin for our discussion this afternoon. So, I would like to call on our PPS DSMC Vice President for her closing remarks.
Good afternoon. Yes, afternoon. Our very informative discussion on dengue has come to an end. But before we all go, the Philippine Pediatric Society Davao Southern Mindanao chapter would like us, especially the media, to remember the following key messages about the dengue situation in the Philippines. First, dengue remains to be a major public health concern in our country. In our region, Davao region, we continue to have high number of cases all year round. Unfortunately, our children are the ones affected by this dreaded disease. Second, we appreciate the efforts of the government to eradicate the disease through the 5S program. However, these strategies have been implemented for decades since the establishment of the National Dengue Prevention and Control Program in 1993. Despite these initiatives, dengue continues to wreak havoc with rising cases and deaths all year round. We need to consider other innovative strategies available to address dengue, especially now that we have seen an upsurge of cases at 30,000 just as the start of the year. The World Health Organization, or WHO, recommends a multi-pronged approach to dengue prevention and control that includes dengue immunization, aside from, as mentioned, vector control and what we are doing, the clinical management. And third, although our country did not have a pleasant experience with dengue immunization, we hope that we do not close our doors to these new generation dengue vaccines. We should remember the lessons from COVID-19. We were able to return to normal because of the availability of the COVID-19 vaccines. Even the smallpox was eradicated because of vaccination. Although there is no such thing as perfect dengue vaccine, benefits outweighs the risk as experienced by other countries that have the vaccines, such as Brazil, which even implemented a national dengue immunization program. Lastly, dengue is not solely a problem of the government. All of us must do our duty to prevent and control dengue in the Philippines. We from the PPS, Davao Southern Mindanao chapter, will always support the fight against dengue. Though proper clinical management and prevention through initiative strategies. For the media, we urge you to be our partner in this dengue advocacy by spreading proper information about the disease that is based on scientific evidences and not only hearsay. With that, in behalf of the Philippine Pediatric Society, Davao Southern Mindanao chapter, together with our dengue experts here, Dr. Aguilar and Dr. Dadia, I thank everyone for being here. Sir Cito, Prof. Cinmayli, and to all of you, I thank you for giving your precious time to be with us today in our advocacy in fighting dengue in our country. Maraming salamat po. We hope that you will be able to go back to your home and family safely.
Thank you, Doc Sally, for that closing remarks. So I guess our drive really here is, for us to help, for us to ask your help, no? To become, hindi lang kasi kami ang magiging warriors dito. Please, may you also have that convincing power to, fight against this dengue disease. So please help us in our campaign against this dengue disease. So I guess that concludes our activity for today. Syempre, we'd like to thank our sponsor, Takeda Philippines, and our speakers, as always, Dr. Delta, Dr. D, magkikita pa tayo. And of course, mukhang makikita namin ng mas madalas si Ma'am Chin in our this fight for dengue. Okay, with that, thank you, and I guess lunch is served. Okay, thank you.